Breaking. Cheap vitamin B3 game changer for millions of people with common disease? By the end of this video you'll see why this could shift how we treat one of the world's most common killers. There's a health crisis many people don't even know they have. It's called metabolic associated fatty liver disease, MASLD, before known as NAFLD, and it affects about 30% of the global population. That's nearly a third of all people. It creeps in silently with fat accumulation in the liver, then inflammation, fibrosis, and eventually liver failure, cirrhosis, or cancer. There are almost no targeted treatments. Most advice is diet, exercise, managing obesity or diabetes. But many patients don't get better or the disease keeps progressing. That's the problem. The solution. Scientists in South Korea have identified a genetic switch in the liver, a microRNA called miR93, that plays a central role in driving MASLD. This microRNA is found in elevated levels in both human patients and animal models. High miR93 suppresses a key gene, SIRT1, which normally helps regulate fat metabolism, lipid oxidation, and keeps the liver clean. When miR93 is too active, SIRT1 gets shut down, fat builds up, liver inflammation rises, fibrosis kicks in. In experiments, deleting or knocking out miR93 in mice produces dramatic results. The mice are fed high-fat, high-fructose diets, which normally generate fatty liver, but with miR93 removed, they show much less liver fat accumulation, much lower markers of inflammation, better insulin sensitivity, and better liver enzyme profiles. Mice overexpressing miR93 do the opposite, worsened liver damage, worse metabolic outcomes. That's still not the cool part. Even more exciting, the researchers screened 150 FDA-approved drugs, so things already known to be safe in many contexts, to see which could suppress miR93. The winner? Niacin, vitamin B3. Mice treated with niacin had lower miR93 in their livers, higher SIRT1 activity, restored lipid pathways, less fat accumulation, less inflammation, improved metabolic markers and liver function. It seems that niacin reverses many of the bad effects driven by miR93. Here's what's tricky. Niacin is cheap, known, relatively safe, but delivering enough to patients, avoiding side effects. Niacin can cause flushing, liver strain at high doses. Determining whether it works in diverse human populations, and seeing how sustainable the changes are over time. These are all hurdles. Also, when miR93 is very overexpressed, some effects of niacin are less in mice, indicating there may be limits or resistance. Still, if niacin works in human trials, this could be revolutionary. Think about it. A vitamin, cheap and accessible, repurposed to be a targeted therapy for one of the world's most pervasive metabolic diseases. The impact would be massive, slowing progression to cirrhosis, reducing incidence of liver cancer, improving outcomes for millions with obesity, type 2 diabetes, cardiovascular risk. It could reduce healthcare burden globally, especially in low-resource settings where expensive drugs are inaccessible. The study comes from Professors Jang Yun Choi, UNIST, Hwayoung Yun, PNU, Nung Hwa Park, UUH, among others, and is published in Metabolism, Clinical and Experimental. In short, MASLD has lacked specific treatments. miR93 has been identified as a genetic driver of disease via suppression of SIRT1. Niacin has been shown in animals to suppress miR93, revive SIRT1, reduce fat, inflammation, fibrosis. The stakes are high because MASLD is tied deeply to the obesity and metabolic disease epidemics, and because its silent progression causes enormous damage before diagnosis. But the hope is high because this could be broadened to human treatments soon, using something already approved and available. If and when human trials confirm these effects, vitamin B3 might become the first ever miR-targeted therapy for MASLD, lowering risk of cirrhosis, liver cancer, and cardiovascular disease across populations. That's not hype, it's emerging science with real promise. We love if you subscribe, like and share this video.